It's easier to prevent a disease than treat a disease. It's less costly to the healthcare system. And we have better patient outcomes when we use prevention, and vaccines is a big part of that. When I was in school as a nurse practitioner, I was taught with a focus on prevention. It's easier to prevent a disease than treat a disease. It's less costly to the healthcare system. And we have better patient outcomes when we use prevention, and vaccines is a big part of that. Working with a mostly geriatric population at this clinic, the shingles vaccine has become very important to me. I have seen the devastating effects from long-term shingles. Talking about people that have lifelong pain and disability, it can affect your vision. There's so many things that can go into that, and it can be prevented with a vaccine. That part of the appointment that I'm spending educating the patient, we're talking about things that, well, I heard that, the COVID vaccine is going to affect fertility. Well, ACOG, which is the American American College of Gynecology, that puts all the up-to-date information, all our treatment guidelines, when to do a pap test, when to, how to treat chlamydia, how to treat gonorrhea. Those things all come from that website, that group of scientists and physicians. So, and they have said safe. The risk of COVID with pregnancy is so much higher than getting the vaccine. So please, if you're pregnant, if you're breastfeeding, get the vaccine, it's safe. This is where I was raised. This is where my children are raised. Possibly my grandchildren will be raised here. I worry about the health of this community. And so I worry about those people that are most vulnerable in the population. For instance, if you and I contracted COVID, we might be fine. We might do okay. But I'm willing to get a vaccine to protect my grandmother, my mother, my neighbors, those kind of things. So yes, and I have seen with not only with shingles, but also with COVID, I've seen people that are healthy, young individuals that have had really some long-term complications. In my practice, I have seen death. I have seen so many complications from COVID, and I'll tell you, I've only seen maybe one complication from the vaccine. So when you look at the big picture and you look at the risk and you look at the devastating effects of COVID, it just makes sense to get the vaccine.